The winter light filtered through broken wooden shutters inside a field hospital on Okinawa. A Japanese nurse leaned over a wounded conscript whose breath came in shallow bursts. Outside, artillery thumped in steady rhythm. Dust drifted from the ceiling with every distant detonation. She wiped blood from her hands with a cloth already soaked in red. Then she froze. Boots stepped into the doorway. Not Japanese boots, American. A surgeon in stained fatigues entered with 2 corpsmen. They carried medical bags instead of rifles. She braced for the end. Instead, he knelt beside her patient. His voice stayed low. His hands moved with practiced speed. The nurse realized she was watching something she had never imagined. American medical staff treating Japanese wounded only minutes after capturing the area. The final phase of the Pacific War created scenes that defied the harsh expectations shaped by years of propaganda on both sides. The Battle of Okinawa, launched on April 1, 1945, placed more than 180,000 American soldiers, Marines, and support personnel against roughly 76,000 Japanese troops entrenched in fortified ridges. Civilian populations, estimated at over 300,000, lived in caves, shelters, and makeshift hospitals amid the fighting. Japan's 32nd Army expected annihilation, not rescue. Medical supplies were critically low by May. Many Japanese hospitals operated in tunnels with limited air, often illuminated only by candles. Nurses performed amputations with minimal anesthetics. Infections spread quickly, and casualties overwhelmed the staff. American forces, advancing southward, encountered these medical shelters during their push through the Shuri Line. U.S. combat medics and naval surgeons, trained to operate under fire and supported by a logistics chain that included hospital ships, field hospitals, plasma supplies, and mobile surgical teams, found themselves confronting the wounded of both armies. Geneva Convention ideals did not fully govern this theater, yet American commanders instructed medical personnel to treat any wounded they encountered when feasible. Some of this stemmed from military doctrine, some from humanitarian instinct, some from operational necessity, since interrogations were easier when wounds were stabilized. Japanese nurses were raised under a wartime system that stressed loyalty to the emperor and warned about American brutality. Training emphasized endurance, sacrifice, and absolute secrecy. Many expected to die when American soldiers reached their wards. They had seen leaflets portraying incoming troops as ruthless invaders. Their hospitals sometimes doubled as defensive positions. Doctors taught staff how to destroy records and comfort dying soldiers expected to refuse surrender. Civilian nurses, mobilized late in the war, worked with limited training but immense pressure. They improvised splints from bamboo, bandages from torn clothing, and disinfectant from wood ash. They believed they would never witness American medical workers treating Japanese soldiers as patients. American medical teams operated under advanced wartime systems shaped by the European and Pacific fronts. Blood plasma distribution, triage units, portable X-ray kits, sulfonamide powders, and penicillin allowed them to stabilize patients quickly. Many surgeons had months of nonstop practice. Their field hospitals moved close behind front lines. Some units rotated wounded from tent hospitals to offshore hospital ships within hours. When they discovered Japanese casualties, they followed procedure. Weapons were removed. Guards stood watch, but the treatment began. Japanese staff, witnessing this, encountered a reality far different from expectations. The tactical situation also shaped these encounters. As the Japanese defensive perimeter collapsed, many hillside bunkers and cave hospitals were isolated. American patrols arrived before Japanese command could evacuate or order mass suicides. Infantry units often radioed for medics when they found severely wounded enemy soldiers. The movement of battlefronts meant that medical staff on both sides became trapped between shifting lines. Terrain on Okinawa, filled with coral ridges, rain-soaked fields, and collapsed structures, slowed evacuation. American forces often used flamethrowers and explosives against cave systems, unaware that some held wounded patients rather than combatants. When surviving staff emerged, the presence of American medical personnel treating anyone injured became a moment of profound disorientation. From the Japanese perspective, the emotional shock came from a clash between expectation and reality. Nurses had watched propaganda films that portrayed Americans as merciless. They believed capture meant torture. Many carried poison ampules intended for suicide. When American surgeons worked on Japanese casualties, the scene challenged everything they were taught. One Okinawa nurse later recalled that she expected to be shot instantly. Instead, she watched an American doctor check a wounded teenager's pulse and motioned for her to hand him instruments. Another nurse from the Imperial Army recounted that American medical teams treated her patients, wounds with materials she had never seen. The absence of violence bewildered her more than any threat could have. Technology deepened these impressions. American plasma bottles, sterilized equipment, gauze pads, and field surgical kits appeared almost miraculous compared to the shortages in Japanese cave hospitals. Japanese medical staff had resorted to reusing needles, boiling instruments in seawater, and rationing bandages until they disintegrated. Many of their patients died from infections that American antibiotics could have stopped. When Japanese nurses saw penicillin administered to their wounded for the first time, the impact remained with them long after the war. Medical technology became a quiet demonstration of industrial capacity and logistical planning that Japan could not match by 1945. The human angle widened when both sides confronted the scale of suffering. Japanese soldiers often pleaded for water or called out for family members in their last moments. American medical teams developed an awareness that many enemy soldiers were teenagers conscripted in the final mobilization. Civilians, including schoolgirls drafted as nursing aides, filled tunnel wards. These young helpers tried to comfort the wounded, even as bombardment shook the walls. American medical workers, stepping into these environments, faced conditions that tested their training. They treated burns from flamethrowers, blast wounds, dehydration, and infections. They worked beside Japanese nurses who still expected death. Gradually, silent cooperation replaced fear. The turning point came during the final weeks of organized Japanese resistance in late May and early June 1945. American forces broke through the Shuri Line, forcing surviving Japanese units to retreat southward. The 24th and 96th Infantry Divisions cleared cave systems that held the remnants of Japanese medical facilities. One significant moment occurred when an American patrol from the 77th Infantry Division reached a large tunnel hospital near Iha. The structure extended deep into a hillside. Candles flickered along the interior. More than 100 wounded soldiers lay on mats. Nurses attempted faint smiles, expecting execution. Instead, senior American medical staff arrived within minutes. They assessed the wounded. They prioritized those with chances of survival. They ordered stretcher teams to begin evacuation. Some patients had been lying in the same position for days. American corpsmen moved them carefully to prevent shock. Another turning point developed on June 13th when American units secured another tunnel network near Mabuni. Inside, Japanese nurses were preparing to destroy medical records and comfort the dying. American artillery fire had collapsed part of the ceiling. Water dripped from cracked rock. Many patients were unconscious. When American doctors entered, they paused to observe the cramped environment before beginning triage. They established a temporary station at the tunnel entrance. They handed out water and food tablets. They used plasma and morphine sparingly due to distance from supply lines. Japanese nurses watched American surgeons perform amputations and wound cleaning. The collaborative shock intensified when American staff motioned for Japanese nurses to assist. Some hesitated, others stepped forward. They realized survival for their patients now depended on cooperation. In several cases, American medical teams chose to remain at Japanese hospitals overnight due to heavy fighting outside. Night brought quiet except for distant gunfire. Surgeons worked under lanterns. Japanese nurses steadied patients or translated their whispered requests for water. American commanders secured the entrances to prevent accidental attacks by friendly units. In these hours, a shared professional focus replaced national hostility. Both sides tried to keep the wounded alive. The environment stripped away formal propaganda. The work became the only priority. Numbers reflected the scale of the turning point. American medical units treated thousands of Japanese casualties on Okinawa, including soldiers and civilians. Some survived because of penicillin and plasma supplies. Others required surgery unavailable in Japanese facilities. Hospital ships offshore admitted Japanese wounded alongside Americans. This moment shifted the narrative for many Japanese medical workers. They witnessed that enemy doctors followed medical ethics even during intense combat. The experience lingered long after surrender. The aftermath revealed contrasting consequences. For Japan, the loss of Okinawa removed the final defensive shield before the home islands. Nearly 100,000 Japanese soldiers died. Civilian deaths exceeded 100,000 from combat, disease, and forced suicides. Medical services collapsed entirely by June. Supplies vanished. Personnel losses weakened Japan's capacity to care for survivors. The nurses who had witnessed American treatment became part of post-war testimonies recorded by occupation authorities and local historians. Their accounts informed later generations about the conditions inside Japan's wartime medical system. For the United States, the battle reinforced the value of advanced field medicine, triage systems, blood plasma distribution, rapid evacuation methods, and antibiotic use saved thousands. The treatment of Japanese wounded also shaped future military medical doctrine. It emphasized that humanitarian actions could improve prisoner management and intelligence collection. Photographs and reports from Okinawa influenced policies in Korea and Vietnam. American commanders recognized that medical intervention had strategic consequences beyond immediate survival rates. The immediate local aftermath involved evacuations to American field hospitals. Some Japanese patients later transferred to repatriation centers. Nurses who survived began reflecting on what they had seen. Their expectation of death at American hands collapsed into a memory of cooperation. Many described their shock at watching American surgeons prioritize enemy wounded. Some admitted they doubted the accounts until they witnessed the scenes themselves. When surrender came in August 1945, some Okinawan nurses joined efforts to rebuild local clinics under American oversight. Their earlier encounters eased communication during the early occupation period. They already knew that American medical staff worked with strict procedures and resource availability far beyond wartime Japan. These memories influenced the return of public health systems on the island. The long-term reflection on these moments reveals that even in total war, individual actions can contradict national narratives. The events on Okinawa showed that trained medical personnel often follow shared professional ethics, regardless of uniform. Japanese nurses who expected death instead saw American doctors applying skills with precision to save lives. Their experiences challenged the wartime perception created by governments and propaganda. The cooperation that occurred inside dark tunnels and shattered hospitals demonstrated that humanitarian decisions can emerge even in the harshest battles. The scenes remain a record of how people confronted suffering with discipline rather than hatred.